So we spoke about what lupus is. So the next logical question you would ask me is, doctor, how do I diagnose lupus? You seem to have scared me, which I didn't mean to. But now that you have, how do we diagnose lupus? So like any autoimmune disease, what I would like to tell you is a diagnosis of lupus is always by clinical picture and then by test, not the other way around. I'll give you a small example. So there was this student, an MBBS student, whose mother had a lot of tiredness and hair fall. She was about 60-year-old, and then somebody decided to get her blood test for lupus done. And in her blood test, ANA, something called ANA was positive, and then all the other antibodies that are associated with lupus were negative. Yet the doctor decided to treat this patient as lupus. Here, this is a clear case of overdiagnosis, because the diagnosis of lupus was based on a blood test alone. So here what I'm trying to communicate is that even if you have a blood test positive, but you are not clinically suspected of lupus, you don't have to really worry. So please don't go to a laboratory and get your blood test for lupus done. Having said that, let me tell you how I or any rheumatologist would diagnose a case of lupus. So when a person walks in, we take a very detailed history, because a person will not walk in with a diagnosis of lupus. The person will walk in with, okay, doctor, I have joint pains, or doctor, I have this hair fall, I have this weird skin rash. Doctor, my nephrologist told me that my kidney is kind of inflamed and he wants an opinion from you. Doctor, I don't understand, I have this fatigue, I have this confusion, along with that I have some mouth ulcers coming. So patient walks in with these complaints, and then me as a rheumatologist would ask them several leading questions, several questions to understand, sometimes rule out certain diagnoses, and then based on the signs and symptoms that you present with, I would keep a possible differential of lupus. And once I'm pretty convinced that this could be lupus and that we should test for lupus, then I would take a blood test. So blood tests also can give us clues to a diagnosis of lupus. Like for instance, when I do a complete blood count, which usually everybody does, which has got hemoglobin, white blood cell count, type of white blood cells in it, and the platelets, here I will find that if one type of blood cell, that is lymphocyte, is low, then it points more towards a lupus diagnosis. Or similarly, if there is platelets that are low, less than 1 lakh, then that would mean that this person might have lupus. Beside this, I would also do some urine tests. If the urine is showing some protein leak or some red blood cell leak, then even that would tell me that, okay, this person might have a kidney disease because of lupus. Then what I do is to confirm what if this is lupus or not, I would take some specialized immunological tests. So these specialized immunological tests, the first one would be anti-nuclear antibody. So this is also known as ANA, anti-nuclear antibody. So anti-nuclear antibody is positive in almost 95% of patients with lupus. 95 to 98% is what we can think, because now the methods that we do at ANA have also advanced. So almost 98% of people with lupus will have positive ANA. So with this, if it is positive, then it gives us more confidence to order for more tests, and then after ANA we would order for something called double-stranded DNA, anti-dsDNA, or an ENA profile, that is extractable nuclear antigen profile, where we will be testing you for a lot of autoantibodies. Some of the things that you would want to know is anti-Smith antibody, anti-Rho, anti-La antibodies, anti-nucleosome antibody, again anti-double-stranded DNA antibody. So all these things can be detected with one test. So the doctor would, if ANA is positive, your rheumatologist would then order for these extended panel of autoantibodies also. Then another thing that the doctor would also order is to see complement levels, your serum complement levels. It could be C3 and C4 or either just one of them. So this will tell how active your disease is in some way. So if this much is able to capture the diagnosis, then fantastic. Based on your clinical symptoms, based on the basic lab test, based on the advanced immunological lab test, if you are able to diagnose lupus, then fantastic. Otherwise, sometimes what we do is we go for getting a biopsy of the kidney done, or we do a skin biopsy to really identify if this is lupus or something else that is mimicking lupus. So if you see, a diagnosis is made first at the clinician's office and later in the lab. If the office diagnosis or the clinic diagnosis is not good, any lab cannot help you to diagnose lupus. So your rheumatologist would want a detailed history, and then they would order a series of blood tests, and if need be, they will do some kind of a biopsy.